Well, you may have been looking for a physician in Battle Creek, and you may have discovered that sometimes that might be difficult. And the folks at Bronson are trying to make that a little bit easier. Bronson breaking ground on a new outpatient campus in Battle Creek. And here to talk a little bit more about that is Laurel Barber, Vice President of Bronson Medical Practices. And she'll spend a few minutes with us right now. Good morning, Laurel.
Hello, Richard.
Thank you for your time today. Really, it is difficult to find physicians sometimes. There's a shortage.
There is a shortage of physicians, particularly primary care providers, and this is a national shortage. A variety of reasons why. One of them is young folks in medical school sometimes want to choose professions that are a little more glamorous or can earn a little higher income.
I see. So they'll choose a specialty of some sort instead.
Exactly.
Wow. Okay. So you've been trying to study this situation. I presume that entities like Bronson try to attract family physicians, right?
Absolutely, absolutely. We have a recruitment team, and we are in a perpetual state of recruitment, especially for primary care providers. And that includes family medicine physicians, internists, and pediatricians.
All right. Well, let's talk about the new facility anyway first. And this is going to be situated on Watkins Road. You've already broken ground there.
Yep, August 8th was our groundbreaking. This will be a 14,000 square foot facility that will open spring of 2017 and hopefully be the home to 7 primary care providers.
All right. What do you have to consider when you're talking about, and we presume these opportunities don't come all that often, but when you're talking about building a new building and encompassing modern medicine, what are the things that you have to think about?
Well, you have to think about efficiency, for one, Richard. I mean, when we look at how to provide health care at a reasonable price for consumers, you have to consider that when you're planning and designing a building. We have become pretty good at that, actually, at Bronson. One of the things that we considered with this building is how to design it so that patients can easily access the facility, can get around in the building, and physicians and their staff can easily provide care in a way that's efficient and minimizes the steps they have to take, for example.
Mm-hmm. And in doing so, you use what's commonly referred to as lean principles. What does that really mean? Lean
principles really mean studying something, understanding the situation, and then using a series of testing experiments so that you can figure out the best way to approach a problem.
Mm-hmm. Is that a decent departure from the way it used to be done?
Yeah, I would say so. I absolutely would. You know, we learn from experiences, right, in everything that we do. And the same is true of healthcare. You know, when you're starting to really pick apart and explore patient care, for example, think about an office visit when you go see your doctor. Wait times can be long, right? I'm sure you've experienced that yourself.
Yeah.
So how can you minimize wait time? And you have to respect the patient, and they have a life and other things to do. So we try to reduce waste in one way by eliminating wait time for patients.
How do you do that? I mean, what can you single out in an experience that a patient has in a place like your building and say, okay, here's where we can make it faster?
Mm-hmm. So we've studied how many exam rooms a physician should have to make them more efficient. How many support staff can support the physician to make them more efficient? What kind of a scheduling template would a physician need to make them more efficient? And, you know, you study all of that and you come up with your best case scenario.
Right. Yeah, and you're comfortable with the way that shook out, I presume.
Yes, actually. And we're designing this building much like the last building that we built in Kalamazoo, where we now house a family medicine practice with 7 providers. We learned a lot from that experience, and we're applying many of those same principles to this building on Watkins Road.
Okay. So when you talk about there being a lack of family practitioners, when you say, okay, we're going to build a new building with a host of new doctors available in those locations, you have to feel comfortable that your staffing levels can support that.
Correct. So we estimate there's a shortage in Calhoun County of somewhere between 12 and 15 primary care providers.
Wow.
And that's based on the population. We look at the number of lives in Calhoun County and then the number of physicians currently providing primary care. Mm-hmm. And there's a formula you can apply to come up with that number.
So as you look at that and then say there's an opportunity to provide a greater service in Calhoun County, do you have the doctors ready to go to that location and be dedicated there, or do they go to Kalamazoo and back? How does it work?
We plan to have dedicated physicians. We think that's pretty important.
Okay.
Because primary care providers need to establish a relationship with their patients, so it's important they're accessible on a daily basis. So we have two providers already recruited for this practice. One is a family medicine physician, and she's starting this month. And the second is a nurse practitioner who starts in September.
All right. And there's time to find more.
Absolutely. We do have time, and we're diligently working on it.
So what's your time frame to open that building?
Well, we're hoping spring. So April, May is what we're targeting.
Okay. And even though it could be wintry and such, the construction workers plow right through that, so you can be ready by spring.
We can be ready by spring. There's some important components of the construction that have to take place before snowfall, as you can imagine.
Right. All right. We're talking with Laurel Barber, a vice president at Bronson Medical Practices, about the new Battle Creek campus. We'll talk more about that when we come back in a minute. And we'll also talk a little bit about the Affordable Care Act and how that's affected the healthcare landscape. Coming up on WBCK. Laurel Barber's with us this half hour from Bronson. We're talking about the new Battle Creek campus. Ground has been broken on that, and as you heard, will be open next spring at 2900 Watkins Road, a 14,000 square foot facility, and a number of physicians will be housed there and dedicated to that space, as there is a shortage of family physicians in Calhoun County. Thus, the motivation. So, Laurel, when folks decide to find a new doctor, this can be a process, right? I mean, sometimes we have to feel as though we are comfortable with that person. How do you recommend folks go about that?
I would recommend that they get on websites and start looking up providers, learning about them. We've done something unique here at Bronson in the recent years. Is we've asked our physicians to videotape themselves, talking a little bit about their background, their training, what's important to them as a physician, and how they practice medicine, their style, if you will. So I think patients can learn a lot from that process. I would also suggest asking family, friends, neighbors who they choose as their physician. Mm-hmm.
Yeah, and maybe you've asked them to talk about some of the things in that video, some of the things that folks most often ask about.
Yes. Yep.
What should people ask about if they have a chance to talk with a doctor or look at that video? What sort of things are generally on their mind that they should know?
They should know the physician's style. It's like all of us, physicians are unique people, and they have a different style with how they approach patient care. Some physicians can be a little more rigid. Some can be a little more open to different lifestyles. Patients with chronic illnesses should make sure their physician's comfortable managing their illness. If they have any specific concerns or problems that they want to have addressed, they should make sure their physician's comfortable addressing those.
All right, fair enough. You know, so often when we hear the Affordable Care Act discussed, it ends up, even if it doesn't start out that way, it ends up being analyzed through a political lens. If we were to just talk about what's happened in healthcare with the Affordable Care Act, from your perspective as a medical professional, what would you say has happened? Has this done what the president said it would do?
You know, it is interesting. I think the Affordable Care Act gets a bad rap, doesn't it? And I think that's because of the political discussions that typically ensue. But, you know, the initiative, the act that was voted into place or put into place, signed in 2010, really was intended to make health care insurance more secure and reliable for Americans. more affordable for families and for businesses to improve access to health care, really is the bottom line. And what we've seen in Michigan, the Medicaid expansion program, which came out of the Affordable Care Act, has been hugely successful. In Calhoun County alone, there are approximately 12,000 people who now have insurance through the ACA who did not have insurance before. This is both through Medicaid expansion and the insurance exchange.
Mm-hmm. Yeah, and certainly that was one of the things the president was adamant about, that some people who did not have insurance would get it through this. Has the affordability part played out the way it should have, or that it was expected?
I think that that's to be determined. That healthcare exchange and the insurance plans that are available on the exchange are, undergoing revision on an ongoing basis, which is positive. One thing that we found early on is that the general public had a hard time determining which plan to choose, right? You get on the exchange, you take a look at the options.
Uh-huh.
So we put in place a mobile insurance navigator, and there's a full-time person available in Calhoun County, and that individual is committed to assisting consumers with the enrollment process. So looking at their individual needs, what type of plan will serve them best.
We have been hearing recently about, I think it was Aetna and United Healthcare, saying we're pulling out of the exchanges because it's not right for us. What do you make of that? Is that because of the complicated nature of this, or are there other inherent problems?
From their perspective, I can't speak to why they would pull out.
Yeah.
I think there's plenty of options available for people to choose, and I think that with some education and assistance, patients can find a plan that serves them.
So it is interesting that a number of folks then have insurance who didn't. But does everybody?
No, there are still many people, and even people with insurance, believe it or not, Richard, still don't access health care in the way they can and should. And some of that is because of access to health care. They may call around and find physicians are not open to new patients, which is one motivation for us to hire additional folks to work in Battle Creek. And I think people develop patterns. So if they're sick, going to the emergency room sometimes is the easier route. Yeah. And unnecessary emergency room visits can contribute to increase in healthcare costs, which we want to avoid. So that's why we're encouraging folks establish with a primary care provider. They can help guide anybody through the healthcare system, helping to hook them up with a specialist if needed, hook them up with testing if they need it, and really helping to preventive care is really where it's at, right? Mm-hmm. We have to take a look at anticipating problems, helping people get healthy before they develop a chronic disease.
Is that difficult to do, to get people in that mindset?
It is. Yeah. Right now we're working on, for example, smoking cessation program in our organization because it's just not enough for a physician to recommend to a patient to quit smoking. It takes a lot of effort and support and a full program. So we are looking at that as an example of ways we can impact the health of our patients.
Mm-hmm. Yeah, we seem to be very literal, aren't we? We have to see or feel the pain or something to get motivated.
Exactly.
Yeah, which we would rather not have happen. Well, it is interesting, and we'll stay in touch and learn how things are coming along with this new facility. Congratulations on that.
Thank you.
We appreciate the update, too. Laurel Barber is a vice president, Bronson Medical Practices, talking about that new building. And you'll see it. You can see the progress on it pretty quickly here, 2900 Watkins Road, and they expect that to be open by spring.